Welcome to Health Connection, your source for better living. Today we're talking with Dr. Sateesh Kesari on heart disease. What is heart disease?
Well, heart disease can take many forms, and usually the population that we deal with, it's adult heart disease, and that generally involves coronary artery disease, which is the arteries around the heart, resulting in blockages and heart attacks. It can also involve the valves of the heart, resulting in regurgitation or leakiness of the valve, and calcification or stenosis of the valve. And then additionally, as you get older, arrhythmias, or you can see them in younger ages also, which involves either slow or fast heart rates. That involves the electrical activity of the heart.
What are the risk factors of heart disease?
Well, risk factors of heart disease can be divided into two broad categories. One is modifiable risk factors, and the other one is non-modifiable risk factors. The ones that are non-modifiable, those are ones that we can't do anything about. Those include age, male gender, and family history of coronary disease. So when we look at the risk factors for heart disease, the ones that are modifiable, the ones that we can change, are the ones that we try to concentrate more on. Those include diabetes, obesity, high cholesterol, tobacco use, and sedentary lifestyle.
If you have the risk factors of heart disease, what are the next steps and what types of screenings are available?
Well, when you are able to identify risk factors in yourself, well, the first thing you should do is see your primary doctor, make an annual physical exam, concentrating on blood pressure measurement, routine labs including lipid profile, your weight, and waist circumference is pretty important nowadays, specifically looking at what we call the metabolic syndrome. And that is a combination of your weight, your cholesterol, your blood sugar, and your waist circumference, which we're trying to see the amount of total body fat, specifically abdominal obesity, which these combination can put you at increased risk for heart disease. And as far as screening, before you even have these risk factors, there's many things we can do to screen for heart disease. It generally depends on your level of motivation and your level of concern, predominantly usually because of some significant family history. And certain testing can help you define your overall risk much better than our traditional risk factors. And that includes testing such as carotid intimal-medial thickness and calcium score testing, which the carotid intimal-medial thickness testing is a simple test of an ultrasound of the carotid artery, looking at the thickness of the wall and to determine whether it's thicker than normal for your age. The other one is calcium scoring, which is a quick CAT scan without contrast of the heart, looking for any calcification in your coronary arteries. Calcium usually builds up after having plaque for many years, and a calcium score can help pick up any degree of calcium in your coronaries. And when you relate that to your age and gender matched, you can get your risk profile further stratified.
What treatment options are available?
Well, if we are considering coronary disease, the first step would be a therapeutic lifestyle change, including a change in diet, avoiding smoking, picking up a lifestyle that involves more exercise, and overall try to maintain a thin body habitus, prolongs life and improves symptoms. It is the mainstay of therapy before moving on to drugs. And there's many different drugs that we can treat with in different combinations that can help relieve symptoms, help prolong life. And if you're refractory to these, in combination with imaging to find out the severity of disease, would be followed with more invasive approaches, including cardiac catheterization, coronary bypass surgery, percutaneous coronary interventions. If we consider arrhythmias if the next thing that we consider would be arrhythmias, then usually most of them, if they're not symptomatic, are treated conservatively. If they are symptomatic or at a rate that is concerning, you can usually treat them with medication. If you fail that medical approach, then you escalate up to more invasive procedures like pacemakers, electrophysiology study with catheters, and radio frequency ablation of certain arrhythmias.
What's important that people should know about heart disease?
I think what I see in my practice is so many people are hesitant to see their physicians because they know they have bad diabetes, they know they have bad heart disease, and it's a scary thought to address this issue. And I think what's important for people to know is that the earlier you come in, the better you do, and we can do wonders nowadays with many of these disorders, and people do very well, and people live for a long time, even with severe disease. We're able to do wonderful things to prolong life, improve symptoms, improve quality of life.
For more information, subscribe to our podcast on iTunes or visit us online at ketteringphysiciannetwork.org.